The acting chief executive of the trust, which runs hospitals in Hull and Cottingham, has told Look North that patients there deserve better. Her comments come after new league tables were published, putting the trust at the bottom, 134th out of 134. Lyn Simpson also admitted that there may be some interpretation of bullying going on at the hospitals. We'll be hearing from her in a moment, but first this report from Crispin Rolfe.
The improvement journey that we're on is going to be a long one.
Change urgently needed at Hull Royal and Castle Hill hospitals.
I think we are talking months into years.
Yesterday we reported how and why both are at the bottom of England's healthcare tables.
This is about a system that is not working effectively, that is not enabling staff to provide high quality care.
I've had some whistleblowers come forward who are concerned about what's going on.
But today the Trust has now put its people up to explain.
We have a relentless flow of patients in through the front door who are acutely unwell, and our ability to get patients out and back home where they belong is compromised.
But others have told us of overstretched staff and unacceptable delays, including at Castle Hill Hospital, where Chris Alpha from Louth is still expecting to receive surgery.
I'm frustrated at the fact that my life is on hold. I can't plan anything, because if I plan something, I may get a date. The fact is I just need some sort of guidance to say, right, you can't do this because you're going in for surgery.
And then there are the staff. From nurses to even consultants, we've been contacted anonymously by current and former NHS workers, with comments ranging from the nursing staff are trying but the issues are around funding and unattainable targets, to workers are leaving on an epidemic scale. This is the worst situation this trust has ever been in, and I suffered horrendous bullying and lasted 4 months before I resigned. All comments which now demand answers. Crispin Rolfe, BBC Look North.
Thank you, Crispin. Well, there has been a huge interest in this story, and as you know, we've been asking for an interview with the Trust's acting chief executive, Lyn Simpson. Well, earlier today, I went to meet her at the Hull Royal Infirmary. Lyn, this is very embarrassing, isn't it? Why are you in this mess?
Well, I wouldn't say we were in a mess, Peter.
134 out of 134. I would call that a bit embarrassing, wouldn't you?
Well, it's more of an opportunity in terms of what we can turn it around to.
So the only way is up?
Absolutely.
Email here. Peter, I've worked at the Trust for the past 25 years. I can say this is the worst I have known the Trust being run. That's from somebody who's worked here for 25 years.
Yeah, that's, I'm sorry that individual feels that way, because we do...
Not the only one.
No, but we do get lots and lots of individuals saying how pleased they are with the care and the treatment they receive in the organisation.
But this is somebody who works here.
Peter, this is very important for individuals who attend our service, that they feel that they get safe, careful, clinical care.
You took over last July. The Trust has got worse since then, hasn't it?
No. The ratings are now recorded as being worse, but this isn't something that's happened in 6 months.
Do you think the people of Hull and East Yorkshire deserve better than they're getting at the moment?
I absolutely do.
So what are you going to do about it?
So, since I've come, I've flushed out with our clinical colleagues what the position is, to really understand what the issues are. I've made that clear and transparent to the board and to the staff across the organisation. And importantly, I've put together in 12 weeks from arriving here an improvement plan which is credible and can sustain improvement.
The RCN told me last night it's absolutely not about the nurses and doctors. One Unison member as well told me there's constant management churn. The management is the problem, isn't it? Do you agree with that?
I think there has been a lot of changes in management. And I think when you get those changes, you can see the application of policy just moving in slightly different directions. So I think it's important that we get some sustainable managers in post.
Is there bullying going on? Have you heard of any bullying? Diana Johnson has had whistleblowers getting in touch with her.
Yeah, I spoke to Diana Johnson last week and I thought she was very, very fair in the discussion that she gave last night.
Is there bullying?
I would suspect that there may be some interpretation of bullying going on in the organisation, which I want to understand, because I've got a zero tolerance to bullying in the organisation.
Do you think that you are worth £279,000 a year to get us to, as I say, it's got worse, to the bottom of the league tables?
Well, I don't think that I have taken the organisation to the bottom of the league tables.
Well, it wasn't 134th at December, was it?
But it's historical problems that have been flushed out so we understand them, which has now resulted in that position being exposed. It's nothing to do with my salary or the fact that I came into post.
Do you think you're worth £279,000?
Well, the salaries for chief executives are set nationally. It's not something that I determine, and it's comparable with other chief execs of large organisations.
Diana Johnson said you might be worth it if you can get us into the top 10. Will you be around long enough, do you think, to
I
get...
hope so. I hope so. I'd like to see those improvements sustained. I want to take the organisation back on the journey where they feel proud of the services that they offer.
I'm not being rude, but you seem to give the impression that there's not much of a problem.
Oh, no. I'm not suggesting that. What I'm saying is there are some deep-seated problems. There are some historical problems that need to be addressed, but you need to understand those before you start tackling them, so you tackle the right problems.
You've got a lot on your plate.
Well, there's a huge amount to do, yes.
Where the trust, where will it be in the next time the league tables are published if you're not 134?
That would be speculating on my part. What I want to do is get a sustained position. So improvements are starting to come through slowly. For example, our corridor care, which is an issue we were criticised on, has greatly improved.
And what do you say to those members of staff who've been in touch, like the one I've just quoted there, who's worked here for 25 years and are really hacked off with the management? In other words, I'm not being rude, but hacked off with you.
Sure. Well, I'd say, please come and speak to me. I want to understand what it is that is really irritating and causing such negativity, and I will address the problems with them.
Come back and talk to us next time the league tables are published. Lyn, thank you very much indeed.
Thank you.
Well, you've heard what Lyn Simpson has said. Having heard her, are you confident now that she will sort this situation out and that the two hospitals will improve and no longer be at the bottom of the league tables? If you work there, very keen to hear from you still. Just to clarify, the trust came out bottom of 134 trusts. You want to be in touch, and then the email address is there, looknorth@bbc.co.uk, looknorth@bbc.co.uk. If you want to get in touch, if you work at the trust, just let me know, and then we won't use any names. Tweet me or text 81333, start the text with the word Look North. So many people have been in touch since we first reported this story, and I asked whether the hospitals deserved their place at the bottom of the league table. Thank you for all the emails, texts and tweets. Many people as well who actually work at the hospitals have been in touch. This first one, anonymous. I have twice been treated for cancer at Castle Hill Hospital and cannot fault the treatment I received. Any faults have to be with management staff and not the medical teams. This one is from Amanda, who says my husband passed away in Castle Hill 4 weeks ago. The night staff are totally overworked. The staff kept apologising for me having to wait for help. And this one, far too many managers, and in some teams they actually outnumber the ordinary staff that they're meant to be managing. Thank you very much indeed for all of those. As I say, do get in touch with your stories on the subject of the hospitals, and if you work there, we'll have some more later in the programme.